Welcome back to Morning Break and today's Open for Business segment where we are pleased to have Comprehensive Home Health Solutions joining us. This is Dr. Sandra Weitz and her daughter, Carrie Ingerman. So thank you both so much for being here. And this is kind of perfect that you guys are a mother-daughter duo because you were telling me before the show that Comprehensive Home Health Solutions is the only family-owned, physician-owned home health care solutions here in the area, which is so cool. And as somebody who works with family, it can be very challenging, but it can also be the best. And so I'm so glad you guys are here together sharing this couch. Carrie, tell us about your business.
Thank you so much for having us here today. We offer interdisciplinary health services at home. So what that looks like is home care, which is a non-medical service, helping people bathe, dress, toilet, manage their daily activities. And then we also offer home health, which is skilled nursing, physical therapy, occupational therapy, speech therapy, and a home health aide in the home. And so people who are homebound can really benefit from those forms of care.
That's so smart.
And patient advocacy.
And patient advocacy, because that's your
advocacy.
role. And so you're the doctor, you're one of the physicians on staff. And one of the things you're telling me that's also really cool about being physician-owned is that, you know, you make yourself available to your patients 24/7, which is not common.
Yes, because one of the things you realize as a physician, you see people in clinic and you send them off with whatever set of instructions, and you don't really have any sense of what kind of support system they have at home. And then if you hire a caregiver, like us through the home care agency, or even if you have home health, they don't actually have access to your physicians. And so that caregiver can call the doctor's office, but anybody who's ever called the doctor's office knows that it's really hard to get a hold of them. Our caregivers call us, families call us, and as a result, you have access to 2 physicians with 70 years worth of medical experience to ask those questions of, and that is really a unique service.
It really is. As somebody who, you know, I just had a baby, I was going to the hospital and to doctor's appointments all the time, and they would be like, do you have any questions for me? And I would always say no, because in the moment I couldn't think of them. And then, you know, 24 hours later, I'd be like, oh, I really wish I could ask that question. Maybe I'll just remember it for next time. But the idea that you guys have that accessibility is huge. And then patient advocacy, also a major deal. And that's where your role is, Carrie. What do you do?
That's right. So I work across the whole agency, but patient advocacy is really helping folks navigate the healthcare system, whether that's insurance and billing, or interpreting what a physician is saying during your appointment, and helping patients be prepared to ask those questions while they're with their physician, rather than having a bajillion questions the morning after. So really being that support system and being able to help them navigate.
That's huge, yeah.
But it's also about understanding what other resources are available, because, you know, one of the things that most people don't know is kind of how do I get my insurance to give me the most of what there is? How do I get Meals on Wheels? How do I get food in my house if I can't drive or I can't leave my loved one to either go shopping or run errands or whatever, or we can help you figure out, okay, for example, Alzheimer's Association has a grant of $1,000. There are many resources available to people to really have them live their best lives at home.
It's just about connecting the resources to the people who need them, and it is so great to have you guys there to be that middleman and that support to them, which is absolutely huge. So I will make sure that all of the information about comprehensive home health will be on our website, kolotv.com, after the show. You guys can check it out and see if it's right for you, your family, or any of your loved ones. So thank you, Carrie and Dr. Weitz, for being here. We really appreciate it.
Thank you for having us.
Thank you guys for watching. We'll be right back.